Hello, and welcome back to another episode of I'm Free Now What with me, Michelleflcsw, a licensed clinical social worker in practice in the state of Florida. Today's topic is going to be something that is near and dear to my heart. It is something called the less harm approach to substance abuse treatment. So, what is less harm approach to substance abuse treatment? Well, I am a social worker, and as a social worker, we are really into protecting and appreciating where people are in their journeys. And so we are there to help people where they're at instead of making them be somewhere else before we will help them. And so self-harm, the less harm approach to substance abuse, what that is we are saying that the requirement of complete abstinence from substances isn't something that all people can achieve, nor is it something that is wanting to be achieved at that point. And it is our responsibility as providers to allow a person to have that sort of space. And so what does less harm mean? What this basically says is, okay, say you are somebody that you have a problem with opiates, and at this point, for whatever reason, not using is not something that you're capable of. Might be that you don't want to go to that place yet. Maybe there's a lot of stuff that's going on that you don't feel that giving up your opiate abuse is going to be the most appropriate thing for you. And so what less harm means is that you'll have people that if you are a needle user, that you'll go ahead and you'll make sure that your needles are clean. That is a society that means that we have needle exchanges available. That means that there's Narcan available. It also means less harm. The less harm approach is also making sure that if somebody wants to not use, that they have methadone available. There's also lots of other different substances where if you choose to do the less harm approach, you're always sitting there and you're making it that there's no long-term negative consequences from your substance abuse that will long-term negatively impact your ability to recover if you so choose to at any point from your substance abuse. That's why the needle exchange is, because having a needle exchange and having clean needles means that you're less likely to get hepatitis C. You're less likely to get HIV. You're less likely to get infections in your skin or in your body if you're using clean needles and you're using appropriate hygiene. Also, if you have Narcan, you're less likely to die of an overdose. So if you're not dead, you can then obviously recover again in the future. And there's all these other different drugs that you can use the less harm approach for. And that's like if somebody's not ready to quit alcohol yet. How about talking about how much we can cut down on alcohol use? We can talk about, limiting it to certain days, certain times, certain things like that. We can also talk about making sure that you get your B vitamins if you're abusing alcohol. So that way, if you choose to stop abusing alcohol at some point, that you're not having to recover from a B vitamin deficiency. If you are choosing to use meth at a certain point and you are not at a place that you can recover, there's about making sure that you stay well hydrated, make sure that you take care of your dental care, making sure that you have safety things in place. So that way, if you start tweaking out too much, you don't run around and do some dumb shit. So there's all these different things that you can do to make sure that if you are not in a place of wanting to abstain completely from substances, that you're setting yourself up with some kind of plan to mitigate or to stop any big harm from coming because of your drug and alcohol use. And this includes as well trying to avoid criminal consequences for your drug and alcohol use. So for instance, okay, you got your DUI because you were driving drunk. You're supposed to be quitting alcohol, but for whatever reason, you're done with your probation, all this other stuff. Now you're off of it and you can go back to drinking. However, you already know that alcohol leads to DUIs. So what a less harm approach would look like if you're going to choose to use alcohol is that you make sure that you don't have access to a car. So it's being able to prevent yourself from making those big life-changing decisions that can really negatively impact you because of your substance abuse, while you're choosing to not abstain from those substances. And when I say abstinence, what that means is that's AA. That's where they say, you will never touch that substance again. That substance is completely off limits. So that is complete abstinence. And when we're talking about the less harm approach, our ultimate goal for all of them is generally to get off of all substances, because substances generally stand in the way of really having healthy lifestyle. It can cause a whole host of problems even if you do them appropriately, but it's also understood that not everybody's in a place where they can stop using those substances. And there is a great, phenomenal book. It's called Over the Influence, and it really goes over all the different substances and about how to approach each substance that could be abused in a way that causes less harm. And what I have found as a provider is that when I've given out that book for people to read, and these are people that were like hardcore, I'm going to use substances till the day I die, fuck you, you can't tell me, blah, 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 blah. And I was like, oh, here's this book on how to do it safely. If you're going to use, might as well be safe about it. And those people that were the most resistant were the ones that when I gave that book and said, hey, use them, but use them safely, they tended to stop using the substances. It's like they had nothing to rebel against anymore. I don't know. That could potentially be the reason why. And now, if you are somebody that you want to get help for your mental health stuff and you want to get some help for your recovery stuff or your addiction stuff, but you are not in a place to give up your addiction, make sure that you find a provider that is comfortable with that. I have known providers that they refuse to do any services for people that are in active addiction. I also know some that if you go into a session under the influence, they will refuse to see you. So it's important that if you are somebody that is having a problem with addiction, that you find somebody that's willing to work with you the way that you are. And I mean, they're completely entitled to work the way that they want to work. There's a back and forth of how much can somebody really pick up in a therapy session if the client is drunk. It's my belief, how drunk are they? I mean, I've had people that they've come in under the influence, somebody else drove them, so I don't have to be worried about them driving. And I also know that them showing up is a big step in itself. And sometimes people need to use substances in order to get to that first step. And I appreciate that and understand it. Not everybody is like that, but there are plenty of other clinicians that are. It's important that if you are having a problem with substances, that you find a clinician that works for you. You might also be somebody that really needs that hardcore one that says, if you show up drunk or high, I'm throwing you out and I'm collecting the full fee. That might make you more accountable to not using substances. It's really important that you figure out what kind of provider you need in terms of your substance use or misuse, or your ability to stay abstinent from substances, or your need to have somebody that is more familiar with the less harm approach. It is always a good idea while you're looking for a provider to go and ask about their philosophy about substance abuse if that is an issue for you. It makes life a lot easier when those expectations are up front, and it makes it where you know what kind of person that you're getting involved with for your therapy. So I hope that this little bitty video kind of helped you learn a little bit about the less harm approach to substance abuse. I hope it helps you figure out who to find for your therapist. Not all therapists are meant for everybody. Not everybody is meant for every therapist. So make sure you get your right fit. Any questions or comments, you already know the deal. Leave them in the comment section below. I tend to try to get back to them. Anything that you would like to talk about in private or get some private information about, you can always hit me up on Instagram. Information is in the About section below. I always wish everybody continued freedom and great mental health. Take care.